Welcome back, everybody, to another episode of Rebellious Wellness Lifestyle. Today, we're going to talk about something that might sound a little bit esoteric, but it is a condition that affects many more women and men than you would think. And the topic is hemochromatosis. If you've been following me for a long time, I have spoken about this in the past. And I think that because many symptoms that could be this or that, I want to talk about this iron overload condition so that you can see if it sounds like you, and we'll get you some help. My guest is Dr. Eric Lewis. He and his wife are naturopaths, and they are experts in the field of iron overload. I would imagine iron deficiency as well.
It comes with the
It comes,
territory. Yeah.
yeah.
Want to know
Yeah.
both sides of the equation.
Yeah. Thank you for being here. I appreciate it, Dr. Lewis.
Pleasure to be here.
So I want you to tell people, first of all, hemochromatosis, explain what it is for people.
So, hemochromatosis, the definition is basically a genetic metabolic disorder of excessive iron absorption from our meals. So, essentially, there are different gene variations that a person can inherit from their parents. And slowly, steadily over time, what it means is that we absorb just a little bit more iron from each and every meal. And so, when you look out over the years, the decades, over a lifetime, it can start to accumulate. And so, in a certain situation, it can lead to iron overload where the storage of iron in your body exceeds what is normal. And this can lead to problems.
Problems such as, let me just say this. Okay, I have hemochromatosis, heterozygous, meaning each of my parents gave me this gene. So I was diagnosed luckily many years ago, so I knew to give blood when I felt a little bit off, and that was the end of that. But the thing that I wanted to get to here is hemochromatosis. You have symptoms, go give blood. It can be really damaging to your system if you don't go get rid of this excess iron. Is that correct?
Absolutely. Yeah. The symptoms can vary. It could be mild, it could be moderate, it could be significant, it could be very severe. In the worst cases, it can be life-threatening. It can be linked to conditions such as arthritis, liver disease, diabetes. A little bit down the road, it can also be linked to some cardiovascular issues. There's some thought of a connection to neurodegenerative disease. And so it can be very varied in its ultimate presentation. In the meantime, it can lead to things like fatigue, joint pain, tiredness, brain fog, anxiety, insomnia. There's really such a wide presentation that's possible. And it gets a little bit tricky because a lot of the symptoms that people may express may look like something else. It
Mhm.
might to hormones or digestion or, oh, there, it's just your stress. You need to learn to relax a little bit. I'm trying to do that, but I just can't. And one
Yeah.
of those potential underlying reasons is too much iron.
Yeah. Do iron deficiency and iron overload, do they mirror each other at all? Are there common symptoms so that one person might mistake an overload for anemia or vice versa?
Because if you think of fatigue and then you think of iron, you're naturally going to think of iron deficiency. And far more people have iron deficiency than do iron overload. But ironically, pun intended, you can both be fatigued from too little iron or too much. And in some ways, it kind of speaks to this Jekyll and Hyde observation about iron that it's absolutely necessary and critical for life. It's how we carry our oxygen in our bloodstream, it's part of how we make energy. But in excess, it can lead to inflammation, it can lead to oxidation, and unchecked, that can lead to things like organ damage, tissue damage, joint damage. And so, yeah, the presentation could be very different person to person.
Is there an estimate of how many people have these hetero or homozygous genes? Like one in 200, one in 2000?
So it varies a little bit based on where you and your family tree comes from.
Okay,
It's called the Celtic curse or Irish illness because
great.
it's prominent in Ireland and the British Isles. And so when you look towards Ireland, the UK, Scotland, you're going to see a much greater percentage. Here in the United States, we're looking at a little bit of a difference between one genetic variation and two genetic variations. So one gene variation, in other words, I inherited something from my mother or my father, is about 1 in 9 people of Northwestern European ancestry. We'll just
Okay.
say generally in that part of Europe. 1 in 9. That's pretty common. In fact,
Yeah.
some would say that it's one of the most common genetic disorders that we have, that we know of. So 1 in 9 have one gene variation. When a person has two gene variations, meaning they got one from both their mother and their father, that's more like 1 in 200 to 1 in 250.
Okay. So when I'm going to speak to women because I don't know much about the male side of it, although you can, because you have one, right? One
I
gene
have one. Yeah, I have
variation.
one
Okay.
copy of C282Y. Yes.
Okay. For women, the most common time to discover this or to experience symptoms is after menses ends because we naturally lose blood every month up until that point. So the blood that might have too much iron is not staying in your body, even though that seems like an awful tiny little bit of blood to think about compared to the pint they take when you go for a phlebotomy. But I'm just saying this so that some women may be experiencing some symptoms, which we're going to talk about right now. So listen up if you're feeling a little bit off lately and you've been out of menses for a couple of years or even more, 10 years, say. Just listen in for some of these symptoms. And we're going to talk more about how to get information from the doctors, Lewis, husband and wife, too. But first of all, let's talk about what are the most common symptoms that you hear from people who find you.
Yeah, so by far the two most common are fatigue and joint pain.
Okay.
And when we look at the joints, it's most commonly in the fingers and hands and wrists.
Hmm.
Also, you can look towards the hip, the knee. Those are probably the most common joints that are influenced. A lot of people will also report musculoskeletal pain, like their muscles are always sore and tight. I obviously kind of link those two together. So
Yeah.
joint pain is very common. Over 50% of people have some degree of joint pain. Again, it can range from mild to moderate to severe. And then fatigue is the other most common one. Again, over 50% of people experience that.
And what are some of you talked about it before we got on, about the symptoms that you hear from people that most of the major hemochromatosis sites don't even mention?
Yeah, I would say over the years, I am more and more inclined to listen to people that have issues with stress, with anxiety,
Hmm.
with insomnia. There isn't as much information about the direct impact of excess iron on the brain and the nervous system itself. It's a little bit behind. We need a little bit more research
Hmm.
in that field, obviously. But from real human beings with this condition, I feel that a lot of people are basically noticing that they feel that their sympathetic nervous system, that fight or flight system that we all have, is always on a little bit more than we'd like it to be. And of course, we're in a 24/7 world. Everyone is connected, everything is go all the time. And so naturally, we live in a time and an era where, we all have central nervous systems that are a little bit on the fritz.
Yeah.
But even in situations where people have taken steps to work on meditation, guided imagery, stress reduction techniques, improving their sleep, so on and so forth, even when people are taking these steps to try and improve their health and their lifestyle, they still find that they're having these nervous system related issues. And it can work its way up to brain fog and feeling like your cognitive functionality just isn't what it should be or used to be. And so I do see a lot of people talking about their impacts on some aspect of their central nervous system, maybe even in terms of their mental, emotional health and well-being. Again, things like anxiety, maybe a link to depression. So I do see a lot of that as well too. If you go down on the list, there are certain skin issues that sometimes come up for people, some digestive issues, some immune system issues. But I would say more often than not, it's the fatigue, it's the joint pain, it's something with the central nervous system. If we look at once iron really starts to become a problem and really starts to build up in a person, then I'd say the three major health concerns that it's most associated with are again arthritis, liver disease, and diabetes. Those are three conditions that can just manifest strictly from iron overload. Of course, people can get arthritis, liver
Yeah.
disease, diabetes from other reasons, but it certainly does not help.
When I am due for a phlebotomy, and especially if I sometimes don't want to go and I put it off, my blood pressure goes up. They put the needle in and I'm done in 15 minutes. They've got a pint of blood. Whereas if I go and everything's normal, it's not quite as high. My blood pressure isn't as high. And I usually have normal blood pressure. So that's a
It's so
symptom that you may
interesting
not
to
have heard.
hear.
Yeah.
Yeah, I know. And my wife and I talk about this all the time is I will sit down in the chair and about 5, 8, 10 minutes in, I just go, ah. It to me, it's kind of like beforehand, I didn't even realize it, but I felt almost like a balloon that was just slightly overinflated.
Mm.
And now they've just released a little bit of pressure from my system. And so I just like my shoulders come down a little bit. I breathe a little bit more easily, just feel generally a little bit better. I do well with phlebotomy. Not everyone does.
Oh, is
Um,
that true? I didn't know that because I'm
yeah,
easy too. I put it off just because we got to go there and sit there, but it doesn't bother me
absolutely.
to get it done, really.
Yeah, no, you'd be surprised. A lot of people do have difficulty, small veins,
Mm.
just needle phobia. Sometimes people are susceptible to low blood pressure. And so, certainly, those are individuals that sometimes will have to work with their doctors on a plan to maybe get a therapeutic phlebotomy, which is a little bit different than the process of just going to the Red Cross or to a blood donation center. You go to a medical center or hospital, and sometimes doctors will be able to prescribe a half phlebotomy. And that way, you're still able to get some of the benefit of reducing iron without taking so much of a person's blood.
I get pretty tired after a blood draw. Like about 3 hours later, I'm ready for bed. Didn't
Mhm.
used to happen that way. I'm sure it's because I'm now an old person, but
It's hard on the body. It's our best therapy, but it can be challenging. And one little tip or trick for those who are considering or who are actively getting it is we talk about the reduction in iron. What doesn't get mentioned so often is how much salt we
mm,
actually lose during a phlebotomy. So all centers will say, be sure to hydrate, drink your water, and that's great. You should do that. But the body loses a tremendous amount of salt
mm.
during a phlebotomy or a blood donation. And it was quite convenient that one of our centers here in town is really close to this fantastic Vietnamese restaurant. So I'd go get some pho soup afterwards, and it was fine
All
to
your
just like
salt is back. Yeah.
get all my salt all the way back at once.
Or an electrolyte drink, I guess, would be, or throw
Absolutely, yeah.
some salt in your
Electrolyte,
water, a little tiny bit of salt in your water.
yeah, those electrolyte packets
Hmm.
or electrolyte drinks, those are fantastic because in addition to losing iron, we're losing plenty of other vitamins and
Yeah.
minerals and nutrients as well that we want to replace so that we can get back on our feet as fast as possible.
Hmm. So let's talk about food and then we'll talk about supplements. When I first got diagnosed, I got a couple of books and they said, watch your intake of red meat, don't take vitamins with iron, duh, and don't eat shellfish because there's some weird thing, or don't walk on the beach because if you cut your foot and you get it was so crazy that I just basically said, all right, I don't eat that much red meat anyway, but if I want a piece of steak once a month and literally like a bite, I'm going to have it. So how
Right.
important is it to watch every single thing you put in your mouth? And what are the things to watch for with the food wise?
It's a great question because people come to iron overload from a lot of different directions, whether it's different genetics, other healthcare conditions that they have. People get diagnosed sometimes in their 30s or 40s. Sometimes people don't find out till their 60s or 70s. That's an individual that has had just more time to accumulate iron over a lifetime.
Mm-hmm.
And unfortunately, there's no absolute, ooh, do this, that, or the other, because it does depend on a person's genetics, their ferritin levels, their iron saturation levels. If someone has screamingly high ferritin, then they need to be very careful with their diet, especially at first.
Okay.
Now, if someone has a very proactive doctor and they find out earlier in life and their numbers aren't quite as high as it would be down the road, maybe that's an individual that doesn't have to be so exclusionary with their diet. But again, part of the genetic variation is that we are absorbing more iron with each meal. And so it only makes sense to make some modifications to that to try and slow the increase in iron that we're ingesting.
What's the shellfish connection? I couldn't make that
Oh,
for
this is,
myself.
yeah, okay. So here's the funky name. It's called Vibrio vulnificus,
Oh, I love it.
which to me that sounds like a spell from Harry Potter, but that's
Yeah.
an actual bacterium, and it is something that is present in our oceans. If we want to get really specific, it's a little bit more concentrated in the Gulf of Mexico and near Europe. And so the connection to raw seafood, if someone wants to eat sushi or very undercooked seafood, there's the possibility that this bacterium could be present. And this is a bacterium that thrives in a high iron environment. You don't want everyone to get all up in arms about this. The strong tendency is that your ferritin level has to be exceedingly high
Okay.
for this to be a problem. I do eat sushi on occasion, and I love seafood and fish a lot of times. I have talked to someone who had a ferritin, I believe, north of 5 or 6,000,
What?
which is
How do you live?
it's so remarkably high. It's hard to say how far out on the bell curve that number is. So we're talking off the charts, but this is a British man, and he did step on a shell in the beach and did end up in the hospital for a couple of weeks
Wow.
and almost passed away. Fortunately, he was treated with antibiotics and they took care of it and he was fine. These are very rare stories.
Mm.
So I don't want people to stop eating healthy foods and things like
Right.
that. There's one individual I worked with many years ago, and I think like in her email address, it was like, I love to walk on the beach at gmail.com or something like that. Like this woman loved to go for long walks on the beach. I know it sounds like a stereotype, but that's what she loved to do. And she became afraid of that. And part of what we talked about was that we got her to the point where her iron was on the control. I was like, please go walk on the beach
Walk
in
on the
your
beach.
feet. So this is a very rare thing, but again, Vibrio vulnificus has this sort of strange air to it. So just wanted to mention that because it's a funny side story.
Well, I'm
But
glad you did because all these years I could never find a correlation of increased iron from eating a clam. Very interesting. Now let's
right,
talk
right.
about supplements. As I mentioned, I don't take a supplement with iron in it. Are there supplements that would increase iron storage? And then what are the ones that you recommend? I realize you're not prescribing, just talking in general about some supplements that could be added to a person's diet with hemochromatosis.
Yeah, so in terms of the do's and the don'ts, obviously we don't want to take an iron supplement or even a
Right.
multivitamin with iron. And other things you might have to be careful for, things like protein shakes. A lot of times those will have a lot of
Mm,
iron added in, meal replacement bars, or if someone wants to grab a Cliff Bar or something like that, sometimes they have a very concentrated amount of iron in there
mm,
because the reputation is that so many people, and women in particular, are iron deficient that a lot of supplements
mm,
and again things like workout protein powders, things like that will have a lot of added in iron to it. So you got to be careful for anything with iron itself. In terms of other nutrients that may impact iron absorption, to increase iron absorption, we're looking at two main nutrients, and one is vitamin C and one
oh,
is beta carotene. Not vitamin A, curious enough, beta
mm,
carotene. The research does spell that out, but beta carotene and vitamin C are known to enhance iron absorption. So this basically pertains to at mealtime. It doesn't mean that you can't ever take vitamin C or beta carotene. It just means that you might want to space it out about an hour or two away
oh,
that might have a lot of iron. Because say you sit down to a meal, has a lot of iron, you take it with capsule of vitamin C or with a citrus fruit or sweet potato or something with a high
mm,
amount of beta carotene in it. That beta carotene, that vitamin C is going to enhance the absorption of that iron,
mm,
and our net absorption will go up from those things. On the other side, there are quite a host of nutrients and nutrient families that will work to inhibit iron absorption. And so there are singular nutrients and categories of
mhm.
nutrients, if that would be good to
Yeah,
go
yeah.
through. Sure. Yeah. So iron inhibitors, probably the simplest one is calcium, whether that is from a supplement or from dairy food or green leafy veggies or from I drink almond milk. My wife drinks coconut milk, right? And usually those will have some calcium in it. So Any source of calcium will work to inhibit iron absorption. And in particular, it will inhibit a form of iron called heme iron. Now, heme iron is a form of iron that comes from animal-based foods. Pretty much all other nutrients that I'll talk about that inhibit iron inhibit non-heme iron, which is the iron that comes from plants, things like spinach, other greens, other veggies, things like that. So calcium is unique in its ability to block heme iron from animal sourced foods. In terms of categories, one of the best categories is called polyphenol. And so if you think of bright, colorful foods, berries like blueberries, raspberries, blackberries, if you think of dark chocolate,
Oh,
if you think of green tea, if you think of coffee, a lot of foods that are very polyphenol rich. A lot of times they'll be referred to as great antioxidant, because polyphenols have great antioxidant abilities. And so when you take these types of polyphenolic rich foods at a mealtime, that will work to inhibit the iron from that meal. And some research would show even up to 60 to 90%. And that's
wow.
extremely significant. Now, again, that's only the non-heme portion
Right.
of it, but that's still a significant thing. So that's polyphenols. Another category is called phytates. So phytates you'll find in whole grains, you'll find it in legumes. And so phytates are also another really strong iron inhibiting agent. Then you start to get into a couple other specifics. There is a particular protein in egg yolks, not the egg white, but the yolk of an egg that can inhibit iron absorption. Eggs are very good at reducing iron from the rest of the meal. There is a factor in soy that I don't think they have a name for, but it's a factor that nonetheless does work to inhibit iron absorption. And probably last but not least are oxalates. Oxalates you'll find in raw spinach and a couple other leafy greens, and those also work to inhibit iron absorption.
Now back up because I thought that spinach was an iron-rich food. So it does
Great
good
observation.
iron, gives it to you and takes it away at the same time.
So here's the deal. Spinach by itself has a lot of iron in it, but when it's raw, the oxalates prevent it from being absorbed. Now, the second you cook it, so you steam it, throw it in the oven, whatever you do to wilt that spinach, that breaks down the oxalates and it releases the iron. And a cup of spinach has almost as much iron as just a regular serving of red meat does. So they're both about 4 milligrams. That's a lot. Now, again, the spinach is non-heme.
Right.
Red meat would have heme and non-heme, but nonetheless, spinach has a lot of iron in it if that spinach is cooked.
Mhm.
And so if you have a raw spinach salad, you're not going to get much, if any, iron from that. In fact, there is one analysis that was looking at this issue and said you'll get more iron from the dirt that wasn't washed off the leaves than you would from the spinach itself if that spinach is raw. But again, you cook it, you wilt it, then you're going to get a lot of iron from that. So that's one of those situational iron levels.
Fascinating. Didn't know that. And as long as we're talking about polyphenols, I have read conflicting information. Red wine is okay and it will help block iron absorption, but alcohol is not good and it will increase iron absorption.
If you just look at like the ethanol part, that will also enhance the iron absorption, right? But red wine is going to have all those polyphenols that you're talking about. And so if someone does choose to have a drink, red wine is probably the best choice.
Okay.
The way we put it is maybe red wine at the top, again, assuming moderation in occasional use, of course, because the liver is very vulnerable to high
Mm.
iron. Liver is also vulnerable to too much alcohol consumption. So that goes without saying. But in terms of moderation, red wine is at the top. Then we put white wine a little bit below that. There are still some polyphenols in white wine, not as much as red wine. And then you'd put sort of beer and liquor at the bottom of the list because you don't have those protective polyphenols. And if we get super specific in terms of the red wine, it's Cabernet Sauvignon that has the highest amount
Mm.
of those polyphenols. So for whatever that's worth.
It is for some people that are going to make a decision about whether to have their Merlot or their Cab Sauv, they're going to have the Cab now.
Because even though it's a disorder of excess iron absorption from our meal, we don't want to feel so restricted and
Mm.
so inhibited because so many people with hemochromatosis have other medical concerns or conditions that they might be following a different nutritional plan for. And so if we just keep layering, don't do this, don't do that,
Mm.
don't do the other on top of everything else, then food starts to become a stress and in a concern rather than something that nourishes us and brings us joy.
And we need as much joy as we can these days.
Yes,
Yes, in life.
absolutely.
So I want to talk about your website. It's hemochromatosis.help.com. That's a mouthful.
Yes, I
Um,
wish it was a lot simpler of a condition,
I
a
know.
lot easier. Hemochromatosis.
Hemo, as opposed to hema. I'm always typing hema. Nope, it's hemochromatosis.
Yeah,
Okay.
hemochromatosis.help.com is our website.
Yes. And your wife has written a couple of books. The one I'm looking at is the food cooking book for people with hemochromatosis.
Yeah, I wrote a book. We call it our diet book because it starts about just more like the nutrients, right? What we're talking about, vitamin C, beta carotene. I get into some of the other specific nutrients because there are different herbs and different specific nutrients that can serve different functions for people with high iron. And I also wanted to just try and write about the condition and try and make things make sense because again, the name itself is hard enough to
I know,
pronounce,
right?
much less understand the dynamics of iron metabolism. So my book is a little bit more like the condition, what it's about, and how certain individual nutrients impact that. My wife took it to the next level and she wrote a cookbook. And so it has over 100 recipes, but it also has several hundred pages of different lists in different considerations, what's good, better, and best. She goes category by category, whether we're looking at vegetables and fruits or grains and legumes, meats, then things like beverages and desserts. And she tries to cover it all to make it as practical as possible so that people can have good, healthy, delicious foods that also work to lower our iron.
Mm. And these days, I was a chef for 20 some seven, whatever years, and I don't usually use recipes to cook by the, like, I don't cook by the 1 teaspoon of this. If I'm baking, that's a different
Mhm.
story. But what I do like cookbooks for is to make me think outside of my box, right? I don't know about you guys. We have our routine. There are certain things I cook all the time. We like them, they're fine. But when it comes to something like this and making a difference in our health, I need that kind of book because I wouldn't have thought, oh, let me add some turmeric or let me grate up some ginger
Right.
or whatever, as opposed to my usual way of doing things. That in that regard, even for a chef, a cookbook is a really helpful tool.
Yeah, yeah. And my wife is a very creative thinker, and she actually tends towards low iron. And so
Oh,
when it
interesting.
comes to actually preparing things, it's a bit of a challenge to meet her needs. And we have two young kids and meet their needs, and then also at the same time meet my nutritional needs. And so she really got the creative juices flowing. And just like you're indicating, especially in certain recipes, you got to get all the teaspoons correct
Mm.
and all the proportions right, especially for baking. But a lot of it is, again, just putting the understanding together of how to understand the basic principles. And then what are you going to do on a Tuesday night? You get home from work and you're tired and you got to put some food on the table. How can we put these principles in action to just get a good, healthy, nutritious meal out there that tastes great?
Yes, I've many times heard that the worst question you can ask your partner is, what do you want for dinner? Because they say, I don't know. What do you want? They say, I asked you, but it's just, we do go through that.
Yeah.
Anyway, what do you want to wrap this up with? This has been so much great information. And I want people to know at the website also, you can sign up for, I would call it a course, a mini course, the emails that you send to
Yeah,
introduce
no,
people to
we do
what you
have a
do.
newsletter. We do have a newsletter, and we describe the condition. We talk about the symptoms. We talk about what to look out for. And then we try to make it as much about nutrition and what we can do for that at home. There are certain nutritional supplements that are very helpful for reducing high iron. There are certain nutrients that have been shown to help with the ramifications of having too much iron. So yeah, we really our newsletter because that's where we're able to not only take a person through the A to Z of the condition, but whenever there's new information that comes out, I'm just about to put out a number of articles on arthritis in hemochromatosis in particular. Anytime we get new updates, that's how we update our readers for for just educating them as much as we can.
Yeah, and I think it's a great idea for that kind of newsletter. It's a great idea for somebody with hemochromatosis, especially newly diagnosed, to stay in the conversation at the beginning. We tend to be such a busy, we read one thing, we think we're good, we're done, I got it. Maybe not, because this is
Yeah,
something that needs to be managed. It's not going to go away. Genes don't change, right? We can influence how they express, but we're always going to have this if we have it.
I 100% agree. We're always going to have to manage this if we have this, but there's a lot of tools that can really help. And what we've tried to do is to, again, break it down to its most important factors and explain it with good analogies so that people will understand this condition and just take them through the process of understanding how to talk to their doctors and advocate for themselves. Because, like we said at the outset, one of the most common genetic variations present, but it is very underdiagnosed and very underrepresented in the medical literature.
Mhm.
A lot of people are walking around for years, if not decades, with this tendency in families because it's
Mhm.
hereditary through families. And a lot of times people, don't know because iron is not routinely tested by most physicians. We think it
Mhm.
obviously should be because it will catch a lot of people who may be early in the process, maybe they haven't developed symptoms yet, but you can see in their numbers that they're maybe trending in that direction. We just want to bring awareness to the condition in advocacy, and it always starts with seeing your doctor, making sure you're getting a full workup with your labs, including iron and ferritin, because that will alert people to this issue as opposed to again, letting time pass and then iron accumulates. And then before we know it, we might have some issues from it.
If anybody listening wants more information, again, it's hemochromatosis.help.com. And again, lots of great information there. A good place to get started. You talk about blood work, you talk about supplements. I think you have your own supplements. So it's a one-stop shop for somebody who has been diagnosed. You can find out all about that at the Lewis's website. So Dr. Eric Lewis, thank you so much. You are the expert among experts in this niche. I'm so glad that I found you online.
Thank you, Greg. It's been a pleasure.
Yeah. Take care, everybody. I'll be back next week with another fabulous guest.